Hello everyone, it is Saturday. I'm not going to try to ignore it. I do have blue glittery nail polish on right now. This is not because I think it's fashionable, this is because I went to a drag party, so I don't know how to get this off, so we're actually just going to keep it in the video. My personal surgery decisions, well, this is pretty apparent. This already happened, top surgery, double incision. People have explained what it was already this week, so you can go watch their videos and I don't have to explain it. Other than that, bottom surgery really is not even in the back of my mind. Like, I think having biological children is in the cards for me. I think I might even give birth depending on, you know, what happens in life. But basically, I can't really touch anything down there as far as hysterectomies and phalloplasties go until, you know, I actually have kids, because I'm not going to have a baby out of a penis. Pretty sure there's nothing, that's not something I can do. So I've been trying to think of what I could say this week that isn't completely redundant, like with all the other videos, and telling my like personal experiences with the surgery. I've done that before. It's not all that interesting, but I found something interesting in my life that I think would be interesting to a lot of you that is completely different than what anyone else on this channel has probably said or will say. So I don't know how it is now, but when I was growing up, I don't know, there's a significant number of trans guys who either explain their chests or explain their scars by saying that they had Gynecomastia, and if you don't know what that is the unnaturally large like breast tissue growth in males, cis males. And trans guys who like didn't want to disclose that they were trans would say like, oh, I had gynecomastia and I had breasts, and then, you know, I had surgery to get them removed. And that's a real surgery, obviously. I mean, if we have top surgery, obviously cis males can also have top surgery. And while I think that was like a clever way to explain what the scars are from or what your chest is from without like disclosing your trans status, there's also certain problems with, you know, using that label when it's not necessarily actually a true label. But all that aside, considering that I do know that there were a lot of trans guys that used to kind of like identify with that label and use that to explain things, I thought that it would be interesting to bring in a cis guy that actually did have that surgery and did have that condition. And he is somebody who you'll probably recognize, I'm guessing. And no, I did not know this about him before we met, so don't ask that either, because I just answered it, so you don't have to ask it. So as you can see, the scars are not even close to what double incision is. See, you can't even see it from any sort of distance. So it's definitely not the same surgery. However, I've heard that the recovery process is kind of the same. I mean, he had to wear a compression binder after surgery. We have to do kind of the same thing. It's the same healing process. Although I don't know, because like his chest, I've seen pictures. It was as big as mine was. And I don't understand how he has those kind of results and I have to have these kind of results. I'm sure there's some sort of difference in like what needs to be done surgically wise. But it really isn't the same surgery. It really isn't the same thing. And when you say it is the same thing, it's not really the same thing. I mean, yes, we are males. Yes, we had top surgery. Yes, we had breast growth as males, but it's not the same as a cis male having gynecomastia. But on that same note, he had dysphoria. He had to hide his chest. He felt like he had to have surgery. Now he has scars. A lot of it is similar, and it's really interesting to like be with him and be able to relate on that level when he's not trans, when it was a pretty similar experience. But now you've seen a real live cis male that had that, and I will see you next Saturday.